The steps that young women should do to become more informed about breast cancer is, number one, know their family history. Really find that out completely. And it may be a little bit intrusive with the family, but that's important. Know when they were diagnosed with cancer and if the cancer ended their lives. Number two, understand what your breasts look like, if there are any new changes in your breast, any new nipple discharge or masses, and see your primary care provider if you're concerned about any new masses. If the primary care provider doesn't feel or validate your concern, you should get a second opinion. Third, get your mammograms at the appropriate age. A woman should start getting mammograms if she's average risk at age 35 as a baseline, and then annual screening mammograms at age 40. Breast cancer is different in younger women in a number of ways. One, it is usually more difficult to identify on a clinical breast exam and also on the x-rays that we do, the mammograms, because younger women have denser breasts. So it's a challenge for the physicians to find it at an early stage. The second reason is that the breast cancers that we identify in younger women tend to be more aggressive. They tend to spread at a faster rate than do cancers in older women. Thirdly, the breast cancers in younger women don't have some of the identifiers that we use to treat breast cancer after surgery, and they don't respond to chemotherapy or hormonal therapy the same because they're not driven by the hormones in our bodies. A breast cancer diagnosis can be very scary, but it's not a death sentence. Currently, if we find a very early breast cancer, even though you're a young woman, the 5-year survival, if there's no spread to lymph nodes and other factors are there, is closer to 95 to 98%. So that's why we talk about early detection, because if we can find it early, we can also save your breast. You don't have to go away with a huge scar. If we have to do a little more surgery, we can also develop the breast so that it looks as close to normal as it possibly can. Thirdly, we can also preserve the ability to have children now. So if you do need additional treatment, such as chemotherapy, after that chemotherapy is completed, we can have you, for the most part, still have the ability to carry a child.